Hello everybody and welcome. This is Dr. Mridula here. So I have seen some parents, when I tell them that, your child has to wear glasses for his or her myopia, the question that comes is, doctor, is it possible to get that LASIK surgery done, which helps to get rid of glasses? Well, certainly not. I would certainly not recommend this LASIK procedure for kids. And let me tell you why. One is because kids generally have a very unstable vision. That is, as they are growing, there is constantly a change in their eyesight or in their power prescription. And especially we see this change when they reach their puberty age or the adolescent period, where there is a sudden increase in their spectacle power also. So for doing LASIK, one of the criteria is that your power prescription should be stable at least for 1 to 2 years. The other thing is, during your childhood and during the early teens, there is a constant change in the shape and the size of their eyeball. So in LASIK, based on what their current prescription power is, we alter the shape of the cornea. But if the power keeps changing as they grow up, then what is the point of getting the LASIK done? The child will never be able to see clearly in spite of doing LASIK if it is done at a very, very early age. The thing is, it becomes very difficult for kids to actually stay still and follow the instructions clearly while doing this procedure, which is again definitely not recommended for kids. On the other hand, as parents, what can we do? In case if your child has mild to moderate myopia, the aim should be to slow the progression of the myopia and not to just get completely rid of it by doing a surgical procedure when the child is really young. That really doesn't help. So in this case, the options are that you could go for is one, go for glasses or contact lenses. Now even we have ortho-K contact lenses or multifocal contact lenses, or even low-dose atropine eye drops work, and make sure that your child has increased outdoor activities. So the final thing that I would like to say is, do not think about LASIK till your child reaches 18 years of age. After that, if the prescription has been stable for 1 to 2 years and if the child has got a very healthy thick cornea and if everything else is fine, which we will evaluate, then you can go ahead for LASIK. Okay? Think about it. Take care.